Ebenezer. I'm consultant physician in Devadas Hospital, Madurai. I'm an MD physician who's also practicing diabetologist and specialist at hypertension. So today we're going to discuss about understanding hypertension. So today's discussion is about understanding about high blood pressure and how to prevent it. Generally, all of us would have a healthy or a normal blood pressure, but what does it mean? Blood pressure is the pressure exerted by the pumping heart on the blood vessels. It creates a pressure against the walls of the blood vessel, and this is called BP, blood pressure. Normally, healthy person, it rises and falls throughout the day. But when the BP remains high for a longer period of time, it can lead to serious health complications. In general, persistent increase in high BP more than normal BP is known as hypertension or high blood pressure. High blood pressure usually develops over time because of multiple unhealthy life choices and also a few genetic problems, and also there's something known as secondary hypertension which happens due to other problems in the body. The unhealthy lifestyle that contributes to hypertension are less physical activity, obesity, smoking, alcohol intake, and increased salt intake, and stress in work and in life. There are other risk factors that can also increase the risk of developing hypertension. One is, as people get older, there is an increased chance of them developing hypertension. Anybody with a family history, there is a genetic probability of them developing hypertension, especially once they cross their teens. Excessive salt intake as a family will also contribute to high blood pressure in multiple family members. Not eating enough food with adequate potassium content like fruits can lead to the risk of developing stroke and chronic kidney disease. Also, eating processed food a lot increases the fat content that circulates through the blood, which gets deposited on the blood vessels and contributes to hypertension. Most importantly, stress, especially during work and generally in life, it's known as a type A personality. That also increases the chance of a person developing hypertension. So does hypertension have any obvious signs and symptoms? Hypertension, like diabetes, it's known as a silent killer because a lot of times it progresses slowly, causing cardiovascular, that is heart disease, kidney disease, eye damage, and subsequently can also lead to blindness once eye damage worsens. So hence, early and accurate diagnosis of hypertension is very important. Best way to actually diagnose hypertension is to measure blood pressure routinely, and to, in case the blood pressure readings are high, to immediately consult a physician for lifestyle advice and, if required, medications. Generally, when symptoms do occur, that is when the blood pressure is very high, the usual symptoms are headache, giddiness, tiredness, vision changes, especially if there is retinal changes which are severe. People can have vision changes, and if the blood pressure is high, increasing the pressure in the brain too, it also causes nausea, that is vomiting sensation, and some people can also cause vomiting too. If any of the person is experiencing these symptoms, they need to get their blood pressure checked immediately. Fortunately, the good thing about high blood pressure, can be easily diagnosed with the simple apparatus, the BP apparatus or sphygmomanometer. Once the blood pressure is measured, ideally, if it's the first time the person's blood pressure is measured, it's best to confirm with two readings. So normally a blood pressure is around 120/80. That is what all of us know. There is a range for the upper level, that is systolic, and there's a range for the lower level, that is diastolic. But on a common note, 120/80 is a good number to remember. The upper number actually indicates systolic, which means that the pressure that is exerted by the heart on the blood vessel, and diastolic is the pressure in the blood vessels when the heart rests. So if BP is more than 140 systolic or more than 90 diastolic, that is 140 in the upper level and 90 at the lower level, that means that he or she has developed hypertension and he or she is also at a very high risk of developing the complications, which we had mentioned, that is heart disease, kidney disease, and eye diseases, and brain disease, that is stroke. On May 17th, we celebrate World Hypertension Day, a day dedicated to highlighting the importance of monitoring blood pressure and also bringing global awareness to about 1 billion people living with high blood pressure worldwide. The theme of this year's World Hypertension Day is measure your blood pressure, control it, and live longer. Uh, uh, for that, we have to ensure that your BP is measured and has to be controlled if it is elevated. I would reiterate the risk that can be prevented and reduced by making a few healthier lifestyle changes. One, exercise regularly, at least 30 minutes a day. Have a healthy diet with less fat, that is less fried items, and less salt, that is less processed food. Quit smoking and alcohol intake. Measure your blood pressure regularly. Manage your stress by doing meditation, yoga, and other stress management techniques. And also adhere to medications once your blood pressure is diagnosed to be high. If blood pressure is successfully controlled by these lifestyle modifications, it might be possible to avoid or delay or at least reduce the need for medications. So let's look at each of these strategies one by one. First, regular exercise or physical activity. Exercise is like a drug. So exercise is a successful drug-free approach to lower high blood pressure. Regular physical activity makes the person's heart stronger. If one has a strong and healthy heart, it can pump more blood with less effort. So if the heart has to work less to pump, the force on the blood vessels will also decrease, and it also lowers the blood pressure. In other cases, as we are all aware, weight gain is also a major risk factor for high blood pressure. And so to keep it less than 120/80, regular exercise will also help in weight reduction. Regular exercise also helps to control blood pressure by, as I had already mentioned, by at least 30 minutes of regular exercise every day, like brisk walking, that is around 4 kilometers per hour speed, jogging, or swimming. The second important lifestyle modification is healthy diet. Diet plays an important part in controlling your blood pressure and preventing the need for medications. A diet which is rich in vegetables, fruits, and whole grains is recommended. And for lowering the blood pressure or preventing hypertension, a dietary intervention that one can adopt is something known as a DASH diet or a Mediterranean diet, eating very less saturated fat and reducing the total fat intake, getting a lot of potassium, which is usually present in the fruits and vegetables, and limiting added salt to the diet and avoiding alcohol consumption. Limiting added salt means avoiding salt rich diet. So DASH diet, as I had mentioned, is in taking a lot of whole grains, fruits, and vegetables, and can reduce the BP even by 10 millimeters mercury. So if your BP is 139, it comes to less than 129. So that subsequently helps in not taking medications. Second is to reduce sodium in your diet. So ideally, best way to reduce sodium is to read the food labels and see foods with high sodium and avoid them. Usually processed foods like chips, pickle, puppet, they all have high sodium content, and so best to avoid those foods. So next is don't add extra salt as much as possible. Try to cut the level of salt and keep it around 2000 milligrams of sodium. That is 1 level teaspoon. Next important lifestyle modification is to quit smoking. Smoking is one of the highest risk factors for developing stroke and heart disease and also hypertension. So quitting smoking actually keeps your BP well under control and prevents you from developing a heart attack or a stroke. Fourth important aspect to actually control your blood pressure is to check your BP regularly. Ideally, best to have a home BP monitoring and also to consult your physician once, if possible, at least a year if you do not have blood pressure, and once every 3 months if you have blood pressure. Self-monitoring of blood pressure also helps to keep our BP on tap, especially if we are on medications. Fifth most important thing is stress management at work and at home. If you can keep yourself stress free, or even if you are stressed, just take a short break from that situation so that your mind relaxes. So once your mind relaxes, your sympathetic tone in the body relaxes, and that also brings the BP down. Listening to music, doing small short periods of exercises even during work, taking a short 2-minute walk, especially if you're stressed, actually helps to bring the stress down. Sixth most important thing is to adhere to medications. Once your physician diagnoses you to have hypertension, that is, your blood pressure is always more than 140/90, more than a few readings, it's best to take the medications regularly along with all the lifestyle changes that have been told, to keep your blood pressure under control, to prevent any complications developing to the heart, brain, eyes, or the kidneys. And once all these lifestyle changes are adapted, once your blood pressure is under control, your physician will actually reduce your medications based on how your blood pressures are on the subsequent readings. So keeping your blood pressure in the normal range is very important in preventing heart complications, and it is very much possible to maintain the normal blood pressure levels with regular monitoring and preventive care. Thank you.